Celeste. I'm a third-year nursing student, and I'm going to be demonstrating how to reconstitute an IV medication through a mini bag. I'm going to do hand hygiene first. I've already compared my MAR with my physician's orders, and they are compatible. So I have my patient here, Mr. Marvin Smith. He is 69 years old. He has dehydration, nausea and vomiting, a urinary tract infection, and his allergies are peanuts. So I have just pulled my medication from the Pyxis machine. I'm going to check the expiry date, and they aren't expired. I'm going to do my first med check with the MAR. So I have ceftriaxone, 1.5 grams. Each vial is 1 gram, so I have enough for my dose. IV every 24 hours, due now at 8:30 for Mr. Marvin Smith. I'm also going to look at the monograph. So I have ceftriaxone, it's an antibiotic, so that's the right reason because Mr. Smith has an infection. It can be administered by a student nurse. The usual dosage is 1 to 2 grams IV every 24 hours, so the doctor's order is within the usual dose. The maximum single dose is 1 gram, and the maximum daily dose is 4 grams, so it's within the safe range. For a 1 gram vial, I will add 9.6 mils of sterile water for injection, for a final volume of 10 mils and a final concentration of 100 mg per mil. I will further dilute it in 50 or 100 mils of D5W normal saline or dextrose saline over 20 to 60 minutes. I am also going to look at the compatibility and potential hazards.
Ordered every 6 hours.
Okay, so now that I have this information from the monograph, I can get my supplies ready for reconstitution.
Good to give now. So I'm going to go ahead and do hand hygiene and pull my meds out.
So first thing I would do is hand hygiene. And I'm going to alcohol swab the tops of the vials for 30 seconds.
Hydrocortisone. My vial is 250 milligrams. My dose is 150 milligrams. It is for IV. It is every
I'm going to let it dry for 10 seconds.
So we are good to go. I am also checking the expiration date on my vial to make sure it is safe to give right now. So everything is good here. I'm now going to go and check my medication.
So the monograph said to add 9.6 mils of sterile water.
So here I have hydrocortisone. It is safe to be administered by a student nurse.
So I'm going to add 9.6 mils of air,
500 milligrams every 2 to 6 hours.
inject it into the sterile water,
6 hours, so it's safe. Maximum single dose of
and pull 9.6 mils.
Maximum daily dose 20.
We're going to get rid of all the bubbles.
And more below those. Reconstitution, the 250 milligram vial. I need to add 1.8 milliliters sterile water to dilute
Then inject into the medication.
a final volume of 2 milliliters and a final concentration of 125 milligrams per milliliter. So now I'm going to go ahead
I'm going to recap the needle safely so I can reuse it later. I'm going to further dilute it between my hands.
sterile water. I'm going to be using 3 milliliters syringe and blood.
So I'm going to do the same for the second vial. I'm going to alcohol swab for 30 seconds.
So first, I'm going to swab the top of each vial for 30 seconds and let it dry for 10 seconds.
I'm going to let it dry for 10 seconds. I'm going to add 9.6 mils of air,
And now I'm getting my
inject it into the sterile water.
and my blood chip needle.
I'm going to get rid of all the
And I need
bubbles.
to drop 1.8 milliliters of air to first inject into the vial of sterile water.
All the bubbles are gone. And inject into the medication.
And then
Going to recap safely. Going to further dilute the medication between my hands.
and I'm going to tap out any air bubbles that are in here.
So, the monograph says that the final volume is 10 mils for a 1 gram vial, and since my doctor's order is 1.5 grams, I've done the calculation and I'll need to pull 15 mils, 10 mils from one vial and 5 mils from the other vial. So I'm going to change my syringe,
Come back up into the syringe to keep the pressure properly in the vial.
making sure I don't touch the ends. And I'm going to alcohol swab the vials again because they have been sitting here for a little while. Make sure that there's no microorganisms on them to maintain aseptic technique.
And I'm going to make sure that
So I'll swab for 30 seconds
before I administer.
and let dry for 10 seconds.
need to
I'm going to add air into both vials to start.
to give the desired dose to my patient. I'm also then going to have to check the SEPA guidelines on how to properly administer it through the SEPA app. So over here, I'm going to do my med calculations.
I'll pull 10 mils from the first vial.
150 milligrams.
Make sure there's no bubbles.
Desired. Over 250 milligrams, which is my dose on hand, times 2 milliliters, which is my final volume. So that turns out to be 1.
And 5 mils from the second vial for a total of 15 mils.
So now,
Get rid of all the bubbles.
I'm going to check my guidelines. And for hydrocortisone doses of less than 500 milligrams, the total volume of the syringe size, I need a 10 milliliter syringe, and the total volume of the syringe is 10 milliliters. I need to set the pump on normal when I go in there.
Okay, I have 15 mils. I'm going to recap.
So since I have 1.2 milliliters of medication, hydrocortisone, I need...
Okay, so now I'm going to do my second check with my MAR, then now that I have my reconstituted medication. So I have ceftriaxone, 1.5 grams, and I calculated my dose, and I need 15 mils. So I have 15 mils here. IV every 24 hours, due now at 8:30 for Mr. Marvin Smith. So I'm going to dilute it in 100 mils of normal saline. I chose normal saline because I know the primary bag hanging is normal saline and they're compatible. I also chose 100 mils because the patient is dehydrated and he could use more fluids.
8.8 milliliters of normal saline in a 10 milliliter syringe.
So I'm going to check the expiry date. It's not expired. I'm going to alcohol swab for 30 seconds.
I'm pulling up 8.8
and let dry for 10 seconds. And I will inject the medication.
There's a few bubbles in this one, so I will make sure to top them out.
I will label my bag. So ceftriaxone, 1.5 grams is the dose. The volume of the medication is 15 mils. The diluent is normal saline, 100 mils. The concentration in this bag is 13 mg per mil, and I have the date and my signature on here. And the total volume of this bag is now 115 mils with the medication. So I'm going to get my supplies ready to go to the bedside.
Into my vial.
I have my medication, my alcohol swabs, my tubing, and my label for my tubing and my MAR. So before I enter the room, or as I enter the room, I'm going to do hand hygiene. So I'm going to go into the room now. As I enter, I'm going to do a safety check, make sure the side rails are up, the patient is comfortable and not in distress, that the call bell is within reach, and that there's no kinks in the line.
Here we go. My patient is Sam Davidson. I'm giving hydrocortisone.
There's no kinks.
Via IV to receive a pump.
Okay, so now I'm going to introduce myself to the patient. Hi, Mr. Smith. My name is Celeste. I am a third-year nursing student, and I'm here to give you your IV medication. Just going to check your armband.
I'm just going to recap my needle.
And can you tell me your name?
I'm going to
Marvin Smith. Oh, same name as my dad. That's cool. And your birthday? Good. Okay, and allergies? Just peanuts? Just going to check your IV site. It looks healthy. There's no redness or swelling.
To make sure I have room.
So I have your antibiotic here, ceftriaxone. This will treat your infection for your UTI. Some common side effects are headache and dizziness. If you notice any of these, just let me know and ring the call bell. You do have the right to refuse this medication. Do you still want it? Yes? Okay. So now I'll do my third med check at the bedside. So I have ceftriaxone, it's the right drug, 1.5 grams, the right dose, IV, the right route, every 24 hours, due now at 8:30, the right time, and Mr. Marvin Smith is the right patient. So I'm going to get my supplies ready now.
And I do perfect 10 milliliters. And now I'm just going to cap it with a small blue cap.
I will hang the primary bag lower than the secondary bag so that when the secondary bag is done infusing, the primary bag will automatically infuse by gravity. I'm going to label my syringe
Put this here, and I'm going to label
with
my
the
syringe.
date, time, and my initials.
I have the name of the medication, the dose, 150 milligrams, the total volume, diluent.
I'm going to alcohol swab the port above the pump
Concentration.
so that the pump can regulate the flow of the medication.
The date, the time, and my initials.
I'm gonna swab for 30 seconds.
So I'm just going to put this here while I get my tubing ready.
I'm gonna let it dry for 10 seconds.
Pull it and make sure that there are no kinks.
So I'm gonna attach the tubing, making sure I don't touch the ends.
Everything looks good here.
And I'm going to back prime.
I'm going to connect.
I'm gonna prime the line so that there's no bubbles. Fill the chamber 1/2 to 3/4 full. Good, there's no bubbles. Oh, a few bubbles there.
Ensuring that I do not touch either end.
Okay, all the bubbles are out.
Now I just need to check this cap off.
I'm going to spike the bag.
A little tiny bit to see a drop of fluid at the end of my line, and that's when I will know it is my
I'm going to hang the bag. And now I'm going to set the pump.
And it is ready to give, being mindful not to again to touch the end. So now,
So I'm going to set my secondary. So the total volume in here is 115 mils. The monograph said to administer over 20 to 60 minutes. I'm going to administer over 60 minutes because this is the first time this patient is getting this medication. I want him to monitor more closely for side effects. So I'm going to set the rate for 115 mils per hour, and the total volume is 115 mils. I'm going to confirm my secondary, and I'm going to press start. I'm going to make sure all the clamps are open,
my MAR, and I will
and I'm going to watch for 2 to 3 drips in the chamber.
take this. And I know there's nothing in the my patient is
All the clamps are open,
for a few reasons, but
and I see 2 to 3 drips. So I'm going to document in the MAR my initials and the time. And I will monitor for adverse effects. I'll stay by the bedside for a few minutes to monitor for adverse effects.
hello.
Okay, Mr. Smith,
My name is
I will be back in a little while to check on you. The medication will be done infusing over 1 hour. I will come back to check the effectiveness of the medication. If you notice any side effects that I mentioned, please let me know and ring the call
here
bell.
to give you your
Thank you.
report.